Well, let me, first of all, thank Chris and others for organizing and Dick for organizing the really important event. Most of them
Thank you.
have served our, put their lives on the line to defend us. Thank all of the workers at the VA for doing a great job today. In my state of Vermont, what I can tell you is there is enormous pride in the work that the VA is doing in terms of health. I go around and I ask people, "You're happy with the healthcare you're getting at the VA?" And people say yes. Now, that may not be true in every part of the country, but it is certainly true in the state of Vermont. Is the VA perfect? No, it is not. So our job is not to arbitrarily fire 83,000 employees. Our job is to understand that we don't have enough doctors, we don't have enough nurses, we don't have enough social workers, we don't have enough custodians. So let us make sure that we in fact have the workforce in every CBOC and hospital, VA hospital in this country that is providing the quality care that our veterans deserve. Yeah. All right, second point that I want to make. I don't know if other people have touched on this. When you have people like Elon Musk talking about the need to privatize anything that can be privatized, you know what they're looking at? They're looking at the VA. All right, why is that? The reason is that a lot of these guys don't like the concept of government. The VA is not a large corporation that makes massive amounts of money for the wealthiest people in this country. What its goal is to provide the best quality care it can to the veterans of our country. Often they do it, sometimes they don't, but that is their goal. And there are forces out there on Wall Street and elsewhere saying, "My God, look at all these veterans. We could make a fortune off of them." So, so one way you do that is lower the quality of care. And by the way, as some of you know, way back after the war in Vietnam, the VA was in really bad shape. And veterans did not want to go into the VA. But our job is not to let them lower the quality through arbitrary cuts in our workforce. It's to improve the quality of care at the VA. So, whereas some want to move to the privatization of VA, I happen to believe that we live in a nation where our overall healthcare system is broken, right?
Yes.
Yeah. Can't afford it. There are long waiting lines, etc. People can't get to a doctor. All right. I want to see the VA being a model of what healthcare in America can be. I want the private healthcare system to have to look at the VA in terms of quality of care, access, efficiency, and cost effectiveness. That is the fight. And we are going to fight very hard to make sure that the VA gets the resources that they need. We're not going to let them make arbitrary cuts in order to, address somebody's win. So thank you all very much for your efforts. Let's go forward together. Thank you.